Good morning, Chairman, Co-Chairman. My name is Pilan Jaipanya, and today I would like to present my research on does hip external rotation stretching exercise improve excessive femoral neck antetorsion. In towing gait is a common problem in pediatric orthopedics, and it is mainly caused by excessive femoral neck antetorsion. Children with this condition usually have excessive hip internal rotation and decreased hip external rotation. This is associated with W sitting, where the hips are internally rotated. Mostly, this will improve with growth, but its persistence could lead to deformity, knee pain, and increased osteoarthritis of the hip and knee. In 2012, Uden has done a systematic review which included Class 4 studies, and the result is still inconclusive. So the gap of knowledge is that no RCT has ever been conducted, so there's no evidence-based guideline of management of this condition. Our study aimed to compare the efficacy of W-sitting avoidance and external rotation stretching exercise in the treatment of excessive femoral antetorsion. We conducted a single-blinded RCT where the assessors are blinded. We are including children aged 3 to 5 years old with in-towing gait due to excessive femoral neck antetorsion, with the physical examination of hip internal rotation more than 60 degrees in males and more than 65 degrees in female. And we are excluding those with neuromuscular disorder, previous hip fracture, dislocation, surgery, and tumor. Our sample size is 30 for each group, and we have referenced this from a pilot study done at our hospital. For the study process, after enrollment, the patient will be randomized by a computerized block of 4 methods. In the control group, the patient will avoid W-sitting, while in the intervention group, they will avoid W-sitting and at the same time do the external rotation stretching exercise of the hip. At the start of the program, baseline data and gait analysis will be collected, and other outcomes will be assessed at the interval of 3, 6, and 12 months. For gait analysis, we are interested in the motion analysis and pedobariography. The parameters we are particularly interested are the hip, knee, and foot rotation, foot progression, and the pedobariography. For our study intervention, in the control group, the patient will avoid W-sitting, which is the position of the deformity where the hips are internally rotated. This is currently the standard of treatment at our hospital because our pilot study has shown that avoiding W-sitting could lead to a significant difference in the internal rotation reduction versus observation alone. While in the intervention group, the patient will avoid W-sitting and at the same time do the external rotation stretching exercise, which we hypothesize will reverse the deformity. The exercise is a static stretching in a hip external rotation position. The duration of each stretch is 15 seconds. The patient will do this 2 repetitions per session with 10-second break apart, and they will do this twice daily with a total program of 12 months. Our primary outcome is the hip internal rotation, and the secondary outcomes are the rotational profile, compliance to treatment protocol, and gait analysis. An evaluation will be done at 3, 6, and 12 months. At 3 months, the patient will be evaluated for compliance and exercise technique. And at 12 months, repeated gait analysis will be done. For data analysis, the continuous data will be analyzed by student t-test and linear mixed model. And for categorical data, it will be analyzed by chi-square test. For our result, we have assessed 53 patients for eligibility, and we have randomized 40 patients, so 20 into each group. In the intervention group, we lost 4 patients during follow-up, and all the patients who were randomized were analyzed. The mean age of our patient is about 4 years old, and the main portion of them are female. There's no significant difference between the control and intervention group at baseline. Regarding the baseline rotational profile, there is no significant difference between the control and intervention group. In the univariate model, age, birth weight, and being a firstborn child is associated with the change of hip internal rotation. While in the multivariate model, the age and birth weight is associated with the change of hip internal rotation. So as the children age by 1 year, the hip internal rotation will decrease by about 3 degrees. On a prospective model, hip internal rotation changes according to time at 3 and 6 months. And in the intervention group where the children do the exercise, the decrease seems to be more potent, but this is still statistically insignificant. This is the same on the left side. And on the external rotation side, there's no significant change according to time and between groups. And this is also the same on the left side. For our discussion, hip internal rotation decreases by about 3 degrees per year, and at 3 and 6 months, the hip external rotation stretching exercise leads to a lower hip internal rotation. So this may be a viable treatment option for excessive femoral antetorsion, but it should be used with caution due to statistical insignificance. The strength of our study is that it is a prospective RCT. We have good concealment, and the assessors are blinded, and we analyze data by intention to treat analysis. The limitations of our study is it is difficult to evaluate the compliance to treatment protocol, and there is no approved standard treatment to compare with. And there's also possible confound by the shoe orthotics bought by the parents, and there is no long-term follow-up data yet. To conclude, hip internal rotation decreases by about 3 degrees per year with growth. Hip external rotation stretching exercise tend to decrease the hip internal rotation according to time at 6 months. No statistical significance has been observed yet, so further studies with more samples and long-term follow-up are needed. Thank you.